You're recording.
Good afternoon, everyone. Welcome to the first interim meeting of the Joint Committee on Children, Youth, and Families. I'm Senator Mary Washington. I'm the Senate Chair, and I'm joined by Delegate Ariana Kelly, House Chair. We'll have three meetings during the interim. They're each around this time. We're doing it via Zoom. Today, our agenda is focusing on the economic impacts of COVID-19 pandemic on women and families. We have a number, to the committee members, we have a number of materials. Each of our presentations are broken out into those materials, and we have something for each of the presenters. We're joined by our amazing committee staff, Ann Wagner and Tiffany Clark. And after my opening remarks and the chair's opening remarks, we're going to start with just a summary of the proposed and enacted legislation that's related to children, youth, and families during our 2021 session. Then we're moving on to a briefing from the Kaiser Foundation. They did a report on women, work, and family during COVID. So that should be very interesting. Then we have the national workforce and wage issues that are impacting women prior to COVID. I think we've seen a lot of reports on that topic, specifically the impacts as it relates to childcare. Updates on COVID relief programs that are specifically available to women-owned businesses. And also the impacts, finally, of public health emergency on women-owned businesses and the workforce. And a briefing from our Women's Commission. So we have quite an extensive opportunity for us to hear. We really are clearly interested in this impact of women and elderly and families during COVID. We're hoping that our presentations will enlighten you, will inform the committee and help us look at things that we need to do in the upcoming session. And also as we continue to work during the interim, we're first of all committed to accountability. What's the progress? What are some information? What are some of the deficiencies of the legislation that we've already been enacted? So our role is an accountability role. Second is evaluation. Really, how are we performing? Could we do better? And also to hear and understand and reinforce that women and families are indeed the backbone, of our successful communities, and they should always be a priority. And we're going to keep a keen eye to social and economic justice, looking at rural concerns as well as urban concerns, racial, sexuality, all the various diverse groups of our constituents that are differentially impacted by COVID. But we're always going to focus on good policy, and we're also going to demand that our executive leadership take responsibility from the top down to make sure that we implement those policies. Delegate Kelly, here's some opening remarks.
Sure, thank you, Senator.
I think you're going to welcome some new committee members too. I forgot to do that.
That's okay, I'm on it. Thank you, Senator Washington. So welcome back, everybody, returning members. And I really would like to welcome the new members on the House side. We're welcoming Delegate Shanika Henson, Delegate Stephanie Smith, and Delegate Jared Solomon, as well as Delegate Buckle, who's taking over for Delegate Kipke's minority leader spot. So welcome to all of the new members and the returning members. Just a little bit on process for this year. It's going to follow a very similar process to that we have followed in the past years. So we have 4 meetings scheduled. The first 3 will be these briefings where we really learn a lot and ask questions and see what types of themes we're seeing coming up in each of those meetings. We will definitely be developing recommendations in the 4th meeting. We may also choose to develop some legislative initiatives. We've been very successful in the past doing that as a committee. Senator Washington welcomed our staff already, Ann Wagner and Tiffany Clark, and I just want to note that Emily Wezek, who is also staff to this committee, is out on parental leave. So I just want to commend us for enacting paid parental leave for state employees. That's some of the work that this committee and others in the legislature have done in the last few years. So with that, I just wanted to say one thing before we start our presentations, because I think Senator Washington covered a lot of it. But we really wanted to have this conversation about the impact of the COVID pandemic, particularly on women and economic security, because I think we feel as though it hasn't been effectively addressed. And so we're looking for ideas for ways that we, as the state of Maryland, can work to address this. A Brookings Institute study said it best, I think. They said COVID-19 is hard on women because the US economy is hard on women, and the virus excels at taking existing tensions and ratcheting them up. So that's what we're here to talk about today. The next meeting will be on long-term care, which also has significant impact on women and families, and the final meeting on childcare. So I suspect that we will see themes raised in this meeting that continue through the next two meetings and will hopefully result in really significant recommendations from us, as well as possible legislative initiatives. So with that, let's welcome our first panel.
Great. And then as our first panel is coming up, I again, this is getting back into the flow of things, I wanted to recognize returning members, our Senate members, Senator Augenstein, Malcolm Augenstein, Joanne Benson will be joining us, Senator Benson, Senator Mary Beth Carrozza, Senator Eckert, Sweet Wave, our Madam Speaker, Senate President Pro Temp, Melanie Griffith, Shelley Hedelman is also a member, and Senator King and Simon Eyre and Sid Noor. I don't know if you want to also recognize the delegates who are returning. Chairwoman.
Great idea, Senator Washington. I see Delegate Krebs is here, Delegate Atterbury, Delegate Ebersol, and I think we have Delegate Rose will be joining us shortly. I'm not sure if she's on yet, but we have great participation on the House side as well. Thank you all for joining us.
Really excited. Okay, so we'll kick off with a summary of proposed and enacted legislation, and that will be from committee staff. That's Ann Wagner and Tiffany Clark.
Thank you, Madam Chair, and thank you, members of the committee, for having us present this today. So as you said, this will be an overview of bills directly related to issue areas that the Joint Committee has followed during the past few interims. Since there's a full agenda to get to, this presentation won't go into detail on all bills affecting children, youth, and families, but any committee members are welcome to briefly discuss other bills following our presentation. So my name is Ann Wagner with the Department of Legislative Services, as well as Tiffany Clark will be presenting the second half of the bills. So to start, the first group of bills have to do with long-term care issues. The first enacted legislation has to do with the topic of visitation in long-term care facilities, and this came up multiple times during presentations last year. Chapter 789 passed and requires the Department of Health to develop guidelines on visitation in nursing homes. Specifically, the guidelines must describe when visitation may be restricted to only certain visitors, and it outlines safety protocols, among other details. And this bill included intent language stating that visitation must be prioritized during a public health emergency to balance the physical needs of residents with the mental and spiritual needs of residents and family members. Moving on to the next bill, chapters 485 and 486 require the Department of Health to develop and publish materials that will help Marylanders with long-term care family planning. The bill states that the materials must be consistent with the Task Force on Long-Term Care Education and Planning's final recommendations. So then moving on to bills related to long-term care that were proposed but didn't pass. The first is Senate Bill 795. And this would have changed the Oversight Committee on Quality of Care in Nursing Homes and Assisted Living Facilities, so that first the membership included a representative of Leading Age Maryland, that there would be 2 co-chairs elected from among the members, and that the Oversight Committee would be staffed by more agencies. Senate Bill 47 and House Bill 806 also relates to visitation, and those bills would have required nursing homes and assisted living programs to establish policies for indoor visitation for essential caregivers, and those are designated by a patient or resident to advocate for them or provide additional personalized care. House Bill 255 would have expanded existing grants that the Department of Aging distributes for aging in place programs and to include senior villages. And these are local member-driven nonprofits that support seniors aging in place. This bill also would have required the governor to allocate at least $100,000 for grants to aging in place programs, with at least 20% of this supporting senior villages. Then moving on to the next topic area this Joint Committee has focused on over the past few interims, and that's childcare. So chapters 243 and 244 require that regulations for childcare centers have probationary employment qualifications for individuals applying to childcare centers. This applies to individuals applying for the first time and specifically in centers serving children who are at least 3 years old. Chapters 437 and 438 also passed and established the Growing Families Childcare Opportunities Pilot Program. This program will provide grants to establish local pilot programs for supporting family childcare providers. And the grantees will provide technical assistance and financial incentives for individuals becoming registered family childcare providers. And the governor is required to allocate $450,000 for this program in fiscal 23 and 24. And that can be, it specifies that can be federal funds to the extent it's authorized. Then moving to proposed legislation related to childcare. The first bill is House Bill 392, which would have required the State Department of Education to establish guidelines for certain developmental screenings for children younger than 3 years old. House Bill 1307 was an emergency bill, and that would have exempted youth development organizations from the definition of childcare centers, and would have required these groups to submit certain information to the State Department of Education. The bill outlined a list of programs that provide out-of-school services to school-age children as these youth development organizations. Then moving on to bills related to child welfare. The first enacted legislation are chapters 315 and 316, which require that the Department of Human Services add or provide new information annually to the General Assembly. This includes certain incidences of abuse or neglect, health and mental health care provided to children and foster youth in the state child welfare system, and other information. And it doesn't affect information that the Department of Human Services already reports to the General Assembly. It also requires the State Department of Education to provide other information on school placements for children and foster youth under this legislation. And then the second bill that this bill takes effect in October, it's chapter 84, and requires the Department of Human Services to post a free online course on the identification, prevention, and reporting of child abuse on its website. So with that, I'll turn the presentation over to Tiffany Clark on the next set of bills.
Thank you, Anne, and good afternoon, committee members. House Bill 930. Can you guys hear me? Okay. House Bill 931 did not pass, but it would have required the state superintendent of schools designee, upon receipt of notification of suspected child abuse within a child care facility, to ensure that parents and guardians are notified. It also would have required family child care providers and child care centers to provide notice to the parents and guardians of all children at the provider center if there is a report or incidents of suspected child abuse. It also established further requirements for the notice and established related penalties for not following through. The next bill is House Bill 701, again, which did not pass, but it would have required the Department of Health to provide each health occupation board that is authorized under law to take action against certain individuals who knowingly fail to report suspected child abuse, with a list of generally recommended courses on the obligation to report abuse and neglect and how to identify abused and neglected children. The next section we're going to talk about is income tax credits. Senate Bill 218 passed, which was chapter 40. And it took effect upon enactment as it was emergency legislation. The bill expanded eligibility of the state and local earned income tax credit and thereby the state and local poverty level credits by allowing taxpayers to claim the tax credits notwithstanding certain federal requirements. The bill also creates a refundable tax credit against the state income tax equal to $500 for each dependent child who is a qualified dependent under the age of 17 and has a disability. The next slide, please. Next, we're going to talk about trauma-informed care and adverse childhood experiences. So chapter 722 and 723 passed and took effect on July 1st. These bills established the Commission on Trauma-Informed Care within the Department of Human Services to coordinate a statewide initiative to prioritize the trauma-responsive and trauma-informed delivery of state services that affect children, youth, families, and older adults. The next slide, please. We have House Bill 774. This did not pass, but it would have required a physical examination for children entering public school for the first time to include a screening for adverse childhood experiences, among other things. Next slide, please. Senate Bill 425 / House Bill 783 did not pass, but it would have established a work group on screening related to adverse childhood experiences. The work group, the work group would have been required to update, improve, and develop screening tools for primary care providers to identify and treat minors who have a mental health disorder that may be caused by or related to an adverse childhood experience, among other things. Next, we're going to talk about school-based health centers. Next slide, please. Chapters 347 and 348 passed and took effect upon enactment as they were emergency legislation. These bills required MSDE and MDH to authorize a healthcare practitioner at a school-based health center to provide services through telehealth consistent with specified provisions of the health occupations article. It's important to note that this bill also prohibits MSDE and MDH from requiring an approved SBHC to submit an application or seek approval to provide telehealth services, which was the case before this legislation was enacted. Also, by July 1st, 2021, MSDE and MDH had to revise the Maryland school-based health center standards to reflect what's in the bill. Next slide, please. And the next group of bills are generally related to education in general. Chapters 256 and 257 passed and became effective on July 1st of this year. This bill expands the definition of homeless youth who are eligible to receive a tuition waiver at public institutions of higher education. It alters the method by which an individual is determined to be a homeless youth for the purpose of tuition waiver. In addition, it authorizes a foster care recipient who receives a tuition waiver to receive priority consideration for on-campus housing, among other things. The next bill is Chapter 345 and 346. These bills passed and became effective on July 1st of this year. These bills require MSDE to develop a model policy to support the educational and parenting goals and improve the educational outcomes of pregnant and parenting students. Each local board of education must establish a local policy based on the model policy. It also requires MSDE to provide technical assistance to a local board to establish these policies. Lastly, the bill also requires each local board of education to excuse any parenting related absence from class due to the use of lactation space to nurse or express milk. Next bill, please. Okay. House Bill 786. This is a proposed legislation that did not pass, and the bill would have required the Secretary of Human Services, the Secretary of Health, and the State Superintendent of Schools to work together to simplify the application process for family support programs. Next bill, please. Senate Bill 437 / House Bill 359 also did not pass, and this bill would have added data on pregnant and parenting students to the data collected by the Maryland Longitudinal Data System. Next bill, please. We have Senate Bill 470, House Bill 439. These bills did not pass, and they would have required 5 local boards of education to collect and track and submit certain information about pregnant, expecting, or parenting students to the University of Maryland School of Social Work. Next bill. Okay, and the last bill is about wealth disparities. This was House Bill 568. This bill did not pass, but it would have established a Maryland baby bond account program, which would have established individual accounts for children with a family income up to 200% of the federal poverty level and made a one-time deposit of $2,000 into each account. And that's all that I have. Ann, do you have any more, Ann?
I think that's it. As you can see, we were quite busy, and why we showed you both bills that passed as well as it didn't pass. If are things that this committee thinks we should reintroduce or should think about in the future, that's that would be helpful. Does anyone have any questions or requests for follow-up on a specific?
I do.
Go ahead. I recognize you. Go ahead.
Okay.
Yes, Senator King. Yep.
One issue that I've been working on since last year, really since COVID started, that I'm hoping since we have a new state superintendent, we might get some movement on it. It's with groups like the Boys and Girls Club. MSDE insisted on them having a license that is basically consistent with a daycare worker. And most of these kids that are coming to these centers are not young children, they're older kids. And while there has to be some regulation, some licensing, it doesn't have to be as strict as a daycare provider. And we had, the Boys and Girls Club had trouble the whole year last year over it, hoping to find a way to get it fixed this year. But any support y'all can be on that, it would be helpful.
Great. I like that idea. Others?
Yes, could I ask a question? Oh, I'm sorry.
Absolutely, Senator.
I'm sorry?
Yes, Senator. Senator Benson,
Yes.
go ahead.
Yes, I'm just curious as to why they, I want to ask the senator, why are we proposing legislation for the Boys and Girls Club? Is there a problem?
Yeah, there was a huge problem last year. MSDE insisted on closing them down a few days because they claimed they didn't have the right license. But then they slowed down the process. It was just a mess through the whole winter last year. So I'm trying to fix it so that we don't do that this year.
I would certainly hope not. Do you understand that? I mean, I'm just hoping everyone understands the importance of the Boys and Girls Club. I have a nephew that Frederick County right now that is extremely successful as a result of his involvement with the Boys and Girls Club. But I could cite countless numbers of young people who have just experienced extreme success as a result of the Boys and Girls Club. So I'm trying to see what I would think that each of the counties would be responsible for the licensing. Is this a state?
They're not actually. The state MSDE does the licensing for it. And Senator Benson, I'll get you to work with me on this thing.
Yes, I'll be glad to do it. Very glad.
Great, thank you. Senator Croza and then Delegate Ebersol. Just letting you know, I'm doing the first hour and then Delegate Kelly will pick up the second hour.
Thank you, Senator Washington. First, a shout out to happy birthday to Senator Addie Eckert. So I wanted to express happy birthday to the senator. And also I see that Delegate Atterbury is on the Zoom as well. And we had worked on some legislation last session that might be of interest to this group as well, legislation to better protect children through the child custody court proceedings. We'll share more information in the future, but just wanted to flag that as a possibility. And if Delegate Atterbury had any thoughts on it, just wanted to share that.
Did you want me to?
Yeah, we're just,
Okay.
you can say me too, or I agree, or.
No, I agree, and we're happy to share information. The bills came out of a work group, and we're working on them more this summer in an unofficial work group, and we're hoping to get them passed next session, but happy to share it with this group here.
Yeah, and yeah, go ahead, Delegate Kelly.
Sorry, I just want to interrupt because I'm taking notes. Delegate Atterbury, I think I was taking notes. The topic of this is child custody hearings, just so.
Yes.
Okay, perfect. Thank you.
In particular, custody hearings when there are allegations of sexual assault and abuse.
Great. I mean, not great, horrible, but
Right.
great topic for us to support.
Okay. Delegate Ebersol and then Delegate Solomon.
Thanks, Madam Chair. Just a quick clarification on the bill concerning Boys and Girls Clubs that was being discussed before. I know Delegate Smith was one of the driving forces behind that. That was designed to plug a hole for school-age childcare that was necessary during the pandemic. And looking forward, it might be good for us to have it, but what it was doing was it's putting a few guardrails on Boys and Girls Clubs so that the care would actually be somewhat commensurate with regular childcare. But my understanding is that there was an agreement that MSDE and the Boys and Girls Clubs came to that meant the legislation really wasn't necessary anymore. And so that's the best way to get things done without legislation. We did a good job, and I commend Delegate Smith for her work on that.
Okay, all right, Kyle. So we'll follow up on that topic. Again, I'm glad we have a committee that's really engaged. We can talk with each other in meetings, but given the what we have so much to get through, but it looks like that's a topic for future discussion. Delegate Solomon, and then we'll I believe Delegate Kelly wants to say something, and then we'll head on to the next topic.
Thank you, Senator Washington, and it's a real pleasure to be on the committee. I apologize, I've been having issues with my laptop. It's in the process of restarting, so I'm using my phone for the time being, but it's really great to be on the committee and appreciate you all highlighting the bill that Senator King and I worked on. I'm excited to do more on childcare. I guess my question sort of specific to legislation and maybe something that we could look at in a future meeting, but I know we're going to have a hearing with appropriations and Ways and Means on sort of some of the federal aid that we've gotten through the COVID response bills, but I think it might be really interesting to see sort of a total of the funding from the various COVID bills that went to programs that sort of fall into these buckets. And I know Senator Washington and Delegate Kelly both sort of mentioned the oversight, some data on sort of what the explicit impact of that money was and what, we hope to see some of the long-term benefits. Because some of the COVID money is obviously not just for immediate COVID relief, but sort of longer-term COVID issues. So it might be interesting to see where that money went and what the outcomes and accountability metrics are.
We'll definitely send those questions. Delegate Kelly, Chairwoman Kelly.
Thank you, Senator Washington. Just wanted to follow up on Senator King's comment about the Boys and Girls Clubs, and I recognize Delegate Smith's work on this and Delegate Ebersol's. Just wanted to add that I'm hearing that there's actually a similar issue happening in Howard County related to the local management board in terms of the licensing for after-school programming, so that it is actually, at least for them, still going to be an issue this year. So we probably want to add a discussion of this to the agenda for our childcare meeting where we'll have MSDE here. So I'm going to suggest that.
Good idea. And now on to a briefing from the Kaiser Family Foundation. We are joined by Usha Ranji and Brittany Fredrickson. Usha is the Associate Director of Women's Health and Policy at KFF, and Brittany Fredrickson is a Senior Policy Analyst. And so I guess we'll pull up their presentation. And we're looking specifically about women, work, and family during COVID. Welcome to the committee.
Thank you all for having us. Good afternoon. I'm going to get us started. My name is Brittany Fredrickson. I'm a Senior Policy Analyst at the Kaiser Family Foundation. We're a nonpartisan nonprofit that conducts health policy research, and we're not affiliated with Kaiser Permanente. And my colleague Usha Ranji and I will be presenting data from a number of surveys that we've conducted throughout the COVID-19 pandemic on women and families. Next slide, please. Some of the key issues that we'll cover are how women have accessed care during the pandemic, how telehealth has transformed care briefly, women as family healthcare managers, and the impact of the pandemic on parent and child mental health. Next slide. By quickly presenting some of the findings from our Women's Health Survey that was conducted among a nationally representative sample of women and men ages 18 to 64 in November and December of 2020. And when it comes to accessing healthcare during the COVID-19 pandemic, we found that many women reported skipping healthcare services, and this was higher among women compared to men. Almost a quarter of women say they skipped a medical test or treatment, as did 15% of men. And almost 4 in 10 women and a quarter of men skipped preventive care, like an annual checkup or a routine test. One of the concerning patterns is that these rates were higher among women in poor health. So nearly a third of women who rate their health as fair or poor skipped recommended tests or treatments, and almost half skipped care. And we know that women's health care directly affects their ability to care for their families as well. If you'd hit next, I think there's an animation here. We found that there was a quarter of women in poor health said that their condition got worse because they went without care. You can go to the next slide. We know that telehealth, though, has been a very viable option for women seeking care during the pandemic. And before the pandemic, we found that just 13% of women had said they'd accessed telehealth. And then after the pandemic, about 40% of women had said they'd access care. However, only 20% of uninsured women, compared to 4 in 10 with either public or private coverage, had a telehealth visit. We found that many women were satisfied with their care, and we know that it will be important to continue to have options for both in-person care and telehealth, so we can continue to reach all populations and that the inequities that are already in the system are not widened. Next slide, please. At the same time, we also conducted a survey of OBGYNs during the pandemic, and prior to March 1st, 2020, only 12% were using telehealth. This had dramatically reversed just 3 months later by June 2020, where only 14% were not using telehealth. Next slide. However, one of the main concerns that providers have for continuing to providing telehealth is being reimbursed at the same rate as in-person care. And over half of providers said that they'd need to be reimbursed at the same rate as in-person care in order to continue providing care via telehealth. There's an important role for policymakers here to decide which telehealth policies will continue to remain moving forward after the pandemic, such as coverage of audio-only visits, allowing a patient's home to be the source of care, payment parity, etc. Next slide. Regarding women's financial difficulties during the pandemic, about a quarter of women, about a quarter of women reported that they'd had trouble paying medical bills in the past 12 months. And among that group, 42% said the problems with paying medical bills were due to an issue they were already experiencing prior to the pandemic. However, a quarter of women said medical bill problems were the result of COVID and its impact on their personal finances. Another 31% attributed problems paying medical bills to both an existing issue as well as COVID. Women with children were more likely to report problems paying medical bills than women without children, as well as younger women, low-income women and uninsured women, and women who reported being in fair or poor health. So in addition to the health effects of the virus, a sizable share of women are dealing with the financial aftermath, which may be harder to see and reminds us that health and finances are strongly connected. I'm going to turn this over to Usha, who will talk more about the pandemic's impact on women's ability to work and care for their families.
Thank you, Brittany. Could I get the next slide, please? Thank you. Good afternoon, everyone. Thanks so much for having us. I want to focus my comments today on mothers, who we know are the primary caregivers in many families. But I think sometimes the magnitude of that gets lost because it has become so accepted. So here, when it comes to healthcare, the Kaiser Women's Health Survey shows that about 7 in 10 mothers say that they are the ones who take their kids for doctor's appointments, get their follow-up care, choose their children's doctors. When we ask fathers, they are more likely to say they share the work with a spouse or partner. But even then, a much smaller share say that they are in charge of these jobs. It's really clear that women play an outsized role when it comes to healthcare for their children. Next slide, please. Thank you. And everyone knows that sometimes kids get sick and cannot go to school. When that happens, it is usually mothers who stay home with them. 6 in 10 mothers report this is the case, as opposed to just about 1 in 10 fathers. This past year, we had widespread school closures and this gender gap persisted. And now, with the new school year having just started and COVID infections rising in many places, school closures could very likely resume, and this year, in fact, with more uncertainty. Should that be the case, it is mothers who are most likely to have to stay home, and this year possibly with a lot less notice. Next slide, please. But that can have really tangible financial consequences. I know this is kind of a busy slide, but if you just look at the orange on the left there, almost half, 47% of working mothers who said that they were the ones who had to take time off when their child's school or daycare was closed were not paid for that time during this past year. If you look, just in fact, 1/3 were fully paid. Among low-income mothers, that's that middle column there, who can really least afford to lose pay, over 2/3 were not paid for time off due to a school or a daycare closure. Next slide. And an essential component and safeguard against this is workplace benefits. While most people, about 2/3 of mothers who work outside the home have some level of paid vacation time and paid sick leave benefits. That really is not the case among those who are lower income. Just about half have paid vacations, slightly less for sick time, compared to over 70% of those with higher incomes. The gap is even wider when we look at part-time and full-time employees. And nationally, most workers across the board do not have paid parental leave or paid family and medical leave. For instance, if you need to take time off because you yourself have a longer-term illness, or you are caregiving for a sick or elderly parent or other relative. And I know your next briefing is on long-term care. I imagine this will also be part of that conversation. But I think, this too has been at the forefront of all of our minds during the pandemic. Lack of a national paid leave policy disproportionately affects women who are more likely than men to be doing childcare and caregiving. Some states, I know Maryland has a paid sick leave requirement, and I learned in the opening remarks also a parental medical leave requirement for at least some employees. Next slide, please. And the gaps are really much higher among some groups. Again, mothers who are Black or Hispanic are more likely to be the ones staying home if their children cannot go to school. Among mothers who are Hispanic, nearly 2/3 lose pay when they miss work to stay home due to a child's illness. Among single mothers, over 7 in 10 are the ones to stay home when kids are sick. Almost 6 in 10 do not get paid for that time. And just, the pandemic, I think, has really exacerbated existing gaps. We heard a little bit about that in the opening remarks too, taking a much larger toll on low-income communities and communities of color, both in terms of the illness as well as the economic consequences. Next slide, thank you. And in addition to time off, a smaller share, but still nearly 1 in 10 women reported having to actually quit a job because of COVID. Similar to time off, this was more common among Black and Hispanic women and low-income women, 17% of whom said that they had to quit a job due to COVID. Overall, among women, the leading reason that they gave for quitting a job was that they did not feel safe at their workplace. And while we don't show it here on this slide, the leading reason among mothers who are working outside the home was school or daycare closure. I raise all of this because, as we know, we are still very much in this pandemic. And so these challenges, workplace safety and school and daycare closures now at the start of the school year, could very well be ongoing. And women's ability to be part of the workforce and make a living is very intertwined with the many responsibilities they shoulder at home. Next slide. And I think we've all heard a little or probably a lot at this point about the impact of the pandemic on mental health. About 4 in 10 parents of school-age children say at least one of their kids fell behind academically. More than 1/3 of parents say they fell behind in their social and emotional development. And about 3 in 10 say their child experienced a mental health or behavioral problem due to the pandemic. I think that we don't know yet how return to in-person school this year more broadly will affect these concerns. Next slide. And when it comes to adults, half of women, which is a pretty striking number, half of women, nearly a third of men say that the pandemic has had a negative effect on their own mental health. About 1/5 of women characterize that impact as major. When we look by race ethnicity, a smaller share, but still over 4 in 10 of Black and Hispanic women said that COVID affected their mental health, compared to about half of Asian and white women. Next slide, please. So I want to end just by saying that I do think at this time we do have opportunities in front of us. There are a number of questions, and I know you've already been talking about them in your committee that we've just touched upon this morning, but ensuring that going forward, telehealth and in-person care are available to women and families. I think women have really expressed a desire in our research, as well as the research of other groups, of going forward wanting both. When we think about mental health, ensuring people have access to high quality mental health care service, I think this pandemic has shined a spotlight on that gap and on that need, and that it is so integral to many other aspects of women's lives. But amidst all of this, I think, really, how do we put equity at the foundation of all of these policies and structures that we want to advance so that they reach that these advancements, telehealth, access to mental health services, access to broader workplace benefits, actually reach all workers, all women and their families, because as we see right now, there are huge gaps. And just to say that, I don't think any of this, falls on the shoulders of any one groups. We've tried to highlight, some of the areas where there's opportunity for policymakers, employers, providers, healthcare providers, who all have a role. So I'll leave it at that. I want to thank you for this opportunity to speak with all of you today. We really appreciate your interest in KFF's work on women and children's health. And we are happy, Brittany and I are happy to answer any questions that we can. Thank you.
Thank you both. And we think your summary and your questions are well stated. I believe the chairwoman Kelly had a comment. I'm looking on my screen.
That's funny because I had not raised my hand, but I did. How did you know? I just had a question actually about, and I'm sorry, I don't have a page number on your presentation, but the chart that says low income women more likely than higher income women to report quitting a job for COVID related reason. I really wanted to just pause on that for a second because I think these numbers are pretty jarring and I want to make sure I'm understanding the one correctly about income. It says, if I'm reading it correctly, 17% who are less than 200% the federal poverty level, as opposed to 5% that are above that. Is that correct? Am I reading it correctly?
You are.
So can you expand on sort of what that means? It's for us as a society, maybe?
Absolutely. What we see is, I think it's another one of those examples of how the pandemic has compounded kind of already, gaps and challenges that were already there in the system. So low income people who, we think of as, being able to least afford to being able to lose income, were more likely to report that they were the ones who had to quit a job. And this is low income women. And, like we said, the leading reason was feeling unsafe at your workplace. And so if you think about some of the conditions, some of the jobs that tend to be lower wage, being, in crowded places, and maybe didn't have workplace protections, I think that could be a big part of this.
Awesome.
But also if you think about like I said, among mothers, the leading reason was school closures. And so you have to also think about access to other sort of childcare support, in the event they were facing a long-term school closure, which many people were.
And maybe it says something about who has access to virtual work and who doesn't in that circumstance.
Absolutely. If you look at, the combination, we know that, and I think we didn't show it here, but we did do some work around paid leave specifically. And this was data from before the pandemic, but just even if you looked at the number of workers, the Bureau of Labor Statistics asks, who has access to just work at home even before the pandemic, and you see a huge income gap.
So just to follow up what you were saying on paid family and medical leave, because in Maryland, we do have paid parental leave for state employees, but we have not yet passed our paid family and medical leave bill.
Okay.
We have seen it the last couple of years, and this committee had a briefing on it last year. And so I'll just remind the committee that that bill did not pass last year, but it will be reintroduced this year by Delegate Valderrama and Senator Hayes. It's called the Time to Care Act for the benefit of the committee.
Great. Others, Delegate Krebs.
Sorry about that. I was going to ask a similar question. I mean, we did pass a bill a few years ago on paid leave, and I just want to see if we could tell if that has had any impact. What's the extent of the impact of the bill that passed previously for larger employees? Is there any data to tell us about that?
I think that might be a great question for the Department of Labor.
I mean, I'm just for later. I just would like to know if whatever we've done, has that had an impact?
Yeah, they're coming up later, Delegate Krebs, in the agenda. So maybe we can ask them and they can be prepared to answer that, hopefully.
Thank you.
When they come up.
And again, I know it's a lot of content, and I absolutely appreciate the analysis and the pointing to the racial and economic disparities. So we got an opportunity to talk about that. But I think one of the reasons we wanted to address this is more broadly of women having to take unpaid sick leave because of COVID-19. And I'm wondering, have you done work about the actual economic impact? Like, what's the dollars and cents? Do you have, like, how much is lost to families when that happens? So we're hearing that, but does any part of your study actually put some numbers as to what's the price of the fact that we don't have, when schools close, that there isn't a good childcare option?
Yeah, I'm sorry, I don't have actual wage information or data. I'm not sure if the department will, but I haven't, I think they have seen some sort of larger studies that have sort of tried to, in the vein of trying to say, X million dollars lost in wages. We did not do that in terms of asking women.
So I think I would just ask the committee and reiterate what the co-chair is saying, that I think that would be something that our committee would really want to know, particularly when we're looking at how much are we spending on childcare, on credits or supports, what's the cost to the system, one way or the other, and if we kind of get in advance of that. So, okay, well, thank you. Any other questions? Great, thank you so much. This was great, and we look forward to following up and appreciate the work that you're doing. Our next group is hearing about the national workforce. And so now we'll get more into the wage issues. We had that interaction of public health impacts, on families and economic conditions of families, but now we're looking again at the national workforce. And we have Catherine Menifee, Georgetown Justice Fellow on the income security. She's with the National Women's Law Center. Are you here? Yes, there you are. Great. If you want to open up your mic so we can hear you.
Yes, thank you so much.
Pull up her presentation. Thank you.
Thank you so much to the committee for having me. I'm very excited to present on these issues. So what I'm going to be presenting on today is the impact of the COVID recession on women and child care workers. So if we can move to the next slide. So we know that the women have been hit hard by the pandemic, and the Kaiser Family Foundation outlined a lot of these things for us. So I'll try to build on their presentation as we move through. But one thing that the pandemic has demonstrated is the deep flaws in our economy that make women's underpaid and undervalued labor our actual safety net. And so this is something that the other presentation really outlined, which is the fact that increased childcare obligations have largely fallen on women. And that's because of illness, remote schools, closed childcare providers, all these things that happened during the pandemic have fallen largely on women. And we also see how it impacts women's work. So women and women of color are disproportionately represented in the poorly paid workforce. And that's going to include many industries, including childcare, retail, and restaurant industries that haven't actually fully recovered from the pandemic. And these workers are, in addition to low wages, are having to also take on the health risks of in-person work. So taking all these factors together, women have lost nearly 3.8 million net jobs since February, and unemployment, even though those numbers are leveling out, it's still high for women of color. So in August, it was 7.9% for Black women and nearly 6% for Latinas. If you can move to the next slide. So I want to talk a little bit about the role of the gender wage gap in this sort of disproportionate impact that we've seen on women and women of color in the pandemic. So in 2019, which is the most recent year that we have this data, women who are working full-time year-round were typically paid just 82 cents for every dollar paid to men nationally. And actually, Maryland has a slightly narrower gap. It's going to be 89 cents for every dollar paid to men in Maryland. And we see that these gaps are larger for women of color. So compared to white non-Hispanic men, Black women are paid 63 cents, 68 in Maryland. Latinas are paid 55 cents, 46 in Maryland. And Native American women are paid 60 cents, 74 in Maryland. And I was talking earlier about those poorly paid workers that are having to do in-person work even as the pandemic resurges. Nearly 2/3 of those workers are women, and they are paid less than their male peers in those occupations. So this gender wage gap builds over time. So for example, in Maryland, over a 40-year career, women will lose roughly $270,000 to the gender wage gap. And these lost earnings compromise women's ability to build savings. And we can see in the pandemic, it's compromised their ability to weather the recession, and has led to part of this disproportionate impact. Next slide. So I wanted to bring our attention to just a couple of specific industries, and a lot of these are those poorly paid industries that I was talking about that are having to do in-person work. So for example, I'll bring your attention to the third line there, the home health aides, personal care aides, and nursing assistants. 87% of workers here are women, and 60% of them are women of color. And so they only make almost $13 in hourly earnings compared to $14.42 that men receive in that same occupation. And so women are only making 90 cents for the dollar, again, doing the same work. And you can see it for other similar occupations in this chart as well. If we can move to the next slide. So when I'm talking about these poorly paid workforce, these workforces that are having to do this in-person work, the one I really want to focus on are childcare workers. Now, childcare workers struggled even before the pandemic. Nearly all childcare workers are women, and disproportionately women of color. Black women make up almost 19%, and Latinas make up almost 18% of the childcare workforce. In comparison, Black women make up about 6% of the general workforce, and Latinas make up 8% of the general workforce. Now, many childcare workers are in poverty. 1 in 10 childcare workers had incomes below the federal poverty line in 2019, and that's compared to only 4.5% of workers overall. And I actually have a chart over here that breaks it down by race, and also has that line showing where poverty is for all workers in all industries. And we can see how childcare workers are higher than that line. And like other low paid workers, childcare workers are less likely to have employer-sponsored health insurance and access to paid sick time or paid family and medical leave. And this is something that the Kaiser Family Foundation really got into depth with, that these workers aren't getting the support that they need in that area. Next slide. Something else, so this was all before the pandemic. These were all the sort of deep-seated flaws in the industry and the economy that made childcare workers vulnerable. But now we're seeing that the pandemic itself has made things even worse. So as of August, a year into the pandemic, more than 1 in 8 childcare jobs are still lost. And childcare providers are still struggling. As the last presentation said, we might see more closures coming up soon. We know that because children under 12 can't yet be vaccinated, childcare providers must still bear additional safety costs and take on fewer children to maintain social distancing. Now, there has been federal funding in the American Rescue Plan to help stabilize the industry, but again, this only deals with the short-term relief needed in the pandemic. It doesn't address those long-term structural problems that have plagued this industry for a long time and that need to be addressed. What the pandemic has shown us is that relying on the underpaid and undervalued childcare workforce, it burdens women, it burdens families, and it burdens the economy overall. Childcare workers need and deserve living wages, benefits, and improved working conditions. Next slide. So one benefit that's very, very important is the paid leave. So before the pandemic, only 1/5 of workers in the United States had access to paid leave through their employers. And as the other presentation highlighted, this was even more stark among the low paid workforce. Among the lowest fourth of wage earners, only 9% had paid leave. And because women take on more caregiving work, they especially need paid time off to take care of their families. So we've actually seen with the Family First Coronavirus Response Act, which was passed in the early days of the pandemic, it was the first national comprehensive paid leave and paid sick days program. And we saw in the early days of the pandemic that this program actually helped flatten the COVID curve. It allowed workers to care for themselves and for their families and to make sure they didn't spread things to other workers. And so it let them take the time they needed to care for themselves. However, even that program still didn't reach all the families that need to be able to access paid leave, paid medical leave. Next slide, please. So what we really need is a national paid family and medical leave program. Such a program would help us recover from COVID-19, but also would help us guard against future pandemics. It would promote economic stability and support caregiving, and especially support women who disproportionately take on that role. It would improve health outcomes because workers could take the time they need to take care of themselves and their family, and would possibly help lower healthcare costs. It would also strengthen businesses because it would reduce turnover and reduce administrative costs associated with it. And throughout this presentation, I have focused on the ways in which women and women of color have disproportionately felt the impact of this pandemic. So I just want to emphasize the ways in which this paid leave program would benefit them, because they have most often been excluded from these protections because they're more often in those low paid jobs that don't have access to these necessary benefits, even as they're taking on the additional risk of in-person work. I also wanted to bring your attention to how this program would help Maryland specifically. So a comprehensive national program like this would reduce the number of working families in Maryland that face significant economic insecurity when they need to take family or medical leave, and would reduce it by 85%. Next slide, please. And so just to wrap up, I wanted to provide a slide that has some additional information. It has my email, and it also has the sources that I've used throughout this presentation, some from our organization and some from partners. But thank you so much for your interest in our work, and I'm open to any questions that you might have.
Thank you so much. And just like the last presentation, the numbers are stark and startling, and I appreciate your recommendation of a national family medical leave program. But as the delegate and others have said earlier, the reality is that given these shocking statistics, and I appreciate your adding Maryland data and contrasting it to the national data, that we have to do something at the state as well. And we really can't wait for Congress to act, and we need to move forward. I believe also, I think Senator Benson, I thought had, nope. Okay, does anyone else have comments or questions? Okay, good, we will progress. Again,
I did want to go.
Yeah, our hands are up.
Oh, I'm sorry, I have to make the screen bigger so I see everybody. Okay, go ahead, Delegate.
I think Senator Benson was first, if that's helpful.
Okay, go ahead, Senator Benson. There you go. Yes, I see you now. Okay. I see Senator Benson, Carozza, Solomon, and Smith. Okay, Senator Benson.
She's on mute.
Get off mute, please.
Thank you.
Okay.
I want to go back and talk about the unemployment problems that we're having in the great state of Maryland. Has anyone who's on this conversation this afternoon or this presentation looked at the impact that it has had on poor women of color, or women, period? Because I have to tell you, in our office, we're working on unemployment, and we have women and people who have not been receiving their unemployment check for as much as 6 months. And so I'm just wondering whether there has been any kind of study that has been conducted as to the impact that it's having on these women who are very, very poor, who we have to take care of right now. We have to feed them. We have to be sure that the children have shoes and clothes for school. We have to be all things to these people. I'm just wondering whether or not there's been a study that's been conducted regarding that unemployment crisis that we're enduring here in the state of Maryland.
Great question to raise up. Law Center, are you able to give us some pointers?
So Senator Benson, just to make sure that I understand your question, are you asking whether there's been a specific study about women who are having difficulty accessing their UI benefits?
Yes, because we have a huge problem with unemployment in the state of Maryland right now. There are many people who have not received their unemployment checks for 6, 8 months, 4 months. It's been really a nightmare. I'm just wondering how this, has anyone looked at it to see the kind of impact that it is happening, that it's taking, the impact that it's taking on people who are unemployed. I mean, people who are poor. I mean, they've had to, I'm dealing right now with people who are homeless as a result of not getting, they've worked, but they have not received their checks, and they're just having a hard time. I'm just wondering, has anyone looked at the impact that it has on women and their children?
No, that's so awful to hear, and I know that we've heard that in other areas as well. I know we've done some work into UI benefits, and so I can look into whether any of my team members have done any investigation into people who are having difficulty receive their benefits. But it's definitely the center works on wanting to change that system, to make that system better, to make sure that women and families are receiving the benefits they need. So I can look into that.
And we can explore that as well. Thank you, Senator Benson. Senator Carrozza, and then Delegate Solomon.
Thank you. And thank you for the detailed presentation about the current status of women in the workforce with COVID-19. My question for you is to ask if you looked at all at the current workforce shortages in several key sectors across the state of Maryland: healthcare, public safety, hospitality industry, that in many cases there are high-paying jobs in these areas that I know those employers are desperately trying to fill. So as we talk about the fact that some of these women at no fault of their own could not work due to COVID, at the same time, if they're coming back into the workforce on a career path where we actually have these shortages where they're paying not only in some cases very high salaries, but with benefits. So I think as we have a discussion about women in the workforce, we have to include the fact that we have these severe workforce shortages in key areas tied to healthcare and public safety, and just wanted to know if any of your work focused on that.
Thank you for raising that, Senator. I know that what we've seen is that a lot of women who would like to re-enter the workforce are having difficulty doing so because of not being able to access childcare or having health risk concerns and other considerations that they're having to balance in the pandemic. So I know those are some factors that might come into what might be seen as shortages. But I think that moving towards trying to provide jobs that have great salaries, that have those benefits, is also should be a real priority. And so I'm glad that you raised that.
Yeah, and I think the senator raises an important point around removing barriers to access to women to the high-paying jobs, and one of those barriers is access to childcare. Delegate Solomon.
Thank you, Senator.
And then Delegate Smith.
Catherine, thank you for your presentation. We've been long talking with MSDE about the childcare workforce, and appreciate you highlighting the fact that this was a huge issue long before COVID. They just had a series of roundtable open forums on how to spend the $200 million that we have for sort of long-term childcare stability stuff. In the group that I was part of, I think in the last weekend session that they had, all of the stuff that you mentioned about the workforce came up: the lack of healthcare, the lack of retirement. We've been working really closely with a number of our state groups around this issue. And I'm just sort of curious if I know the National Women's Law Center, does great national work on childcare. If you all have any lists of sort of what other states or jurisdictions are doing with their money. Like, I know New Orleans, I had read, is literally hiring specific navigators to help their childcare workforce get insurance on the exchange, and then I think they're going to cover out-of-pocket deductibles for a few years. But examples like that, or sort of model policies that states are doing, and obviously the COVID money is temporary, but literally the reconciliation bill just came out in the House. So, hopefully we will see an infusion of federal resources, fingers crossed on that. But just curious, at least on the COVID response with the recovery money, if you've seen, or if you have a list of sort of the model policies or really good examples of what other jurisdictions are doing that we could push MSDE to follow.
Thank you so much for that question. And I would like to echo your hope that we can see more money coming in through the reconciliation process. So I have colleagues within the center that work more specifically with state work when it comes to childcare. So what I can do is I can check with them to see if we have any of those models, because you're right, it's important to be able to put that money where it's going to do the most benefit. So I can check with them and then follow up with you.
Great, and thank you, Delegate Solomon. Delegate Smith.
Thank you, Madam Chair. I also want to thank you, Catherine, for your presentation. I just have two quick questions, and one might be moot if you didn't have a lot of data to answer for the first one. So I know that within the context of COVID, when people are looking at policies, we are looking to not simply go back to normal, because as you noted through your presentation, a lot of what we've tolerated to date has been highly inequitable and problematic on its face. I wanted to know if your research distinguished childcare workers that worked in like facilities and centers from those that were in a home, more, you know, that type of domestic situation. If so, I guess, you know, I know that Virginia had recently adopted, you know, a kind of domestic workers bill of rights, so a little more expansive beyond child workers, but related, you know, because sometimes they have dual functionalities in a home. But I guess, you know, when you're mentioning, and it might have been the prior presentation, that people felt unsafe in their work environments, I thought about the childcare workers that may still be working in a home context may feel more exposed and vulnerable and feel like they have less pathways to, you know, kind of challenging those worker conditions. So I guess that's the twofold question. What data, if any, do you have about childcare workers in the domestic context, and what solutions have you seen people bringing to bear, maybe similar to what Virginia did?
That's a really important distinction, and it's something that we try to keep account of, the difference between people that are in facilities and then more informal, either in domestic context or even more informal care, like through families and neighbors and things like that, and wanting to make sure that all of them are accounted for. Most of the numbers that I was providing was sort of holistic, national, that takes all those groups into account. But I think you're also asking specifically about how we can help those workers in particular advocate for themselves or receive benefits. Was that your question? Okay, and I know that's something that we're working on specifically in the context of child tax credits, right? Making sure that and other tax credits, making sure that families and workers who maybe would have less access can receive them. And in other areas, that can also be something that I look into. Are there any particular benefits or specific things that you want those workers to advocate for that you'd like?
Well, some of the things that have been mentioned in the broader conversation, I know that some of our localities have their version of domestic worker protection, but I'm just not really aware of like what statewide minimums exist, particularly, you know, some of the other benefits with sick leave and so forth, you know, because sometimes it could just be really, you know, fuzzy, your relationship to your employer in ways that are a little more expressed when you're at a kinder care, you know, or a facility like that.
No, that makes a lot of sense. And I don't have that data with me right now, but I can check.
Yeah, thank you for that. And then I'm getting ready to pass the baton on to Delegate Kelly for the second half, but I wanted to just raise just broadly, well, again, thank the people that have presented so far, giving us a lot to think about. And I think one of my sort of questions or thought about, so when we're thinking about families, while we do need to maintain that there are distinctions between male salaries and female salaries, but fathers and other types of partners are also part of families. And so let's try to figure out you know, how do we talk about those impacts as well? And then also on the mental health piece, I appreciate the research, but I'd like to get into some maybe age differentials. Do we see some understandings of what teenagers are doing, how teenagers are being disproportionately impacted, or some of them self-medicating due to stress around COVID? So I'll just follow up with those types of questions for those who've been conducting our research. Okay, take it away, Delegate Kelly.
Thank you. Before we move on to the next panel, I see Senator Eckert has a question, so let's have Senator Eckert go ahead.
Sorry about that, Senator.
Thank you all very much. And I really appreciate, Catherine, your presentation, but I was very fascinated with Delegate Solomon's discussion about different childcare models. And I just wonder, you know, because what we've been doing for years isn't working, will the group be looking at, or will Catherine, had you already looked at different models of childcare in a way that will be more helpful to our families in need. So I guess if that's not already on the agenda, we might want to have some more specific information about that. And as we look at early childhood education, we had always hoped to have a model program in our School of Technology to be able to work with our universities and even some of our community colleges in looking at ways that we could do two things, have a child care center on worksite or some kind of a co-op. So I'd be interested in different models that might be presented or explored. Thank you.
Got it. Thanks.
All right, so with that, I will take over, and I think let's do a little time check here. It is 2:10. We definitely need to be done by 3. We have 3 more briefings. I'm going to go ahead and switch this to the model. If we were in person, we would have all these folks up at the table at the same time. So let's do the 3 presentations in a row, and then we'll do questions for our state agencies. Okay, so we're going to hear first from the Department of Commerce. We have Sarah Shepard here. It's exciting to see you. Thank you. And then we will hear from the Department of Labor, and then we will hear from the Commission for Women, and then we will have questions from members. Sarah, are you here?
I am here.
Excellent. So Sarah is the Director of Education and Workforce with the Department of Commerce. Thank you for joining us, and away you go.
All right, well, good afternoon, Chair Washington, Chair Kelly, and committee members. As mentioned, I am the Director of Education and Workforce, but I also serve as the Program Manager for our COVID-19 relief programs over the past year and a half. So I'd like to share with you some information about 3 of our main COVID-19 relief programs and their impact on women-owned businesses in the state. These were our primary small business assistance programs created in response to the pandemic. And this funding was really separated into 2 pots: our initial grant and loan programs created in 2020, and the new programs created by the passage of the Relief Act of 2021 earlier this year. So in the early, go back to the last slide. Yep. So in the early days of the pandemic in March 2020, Commerce established 2 small business emergency relief programs: a small business grant program, which provided up to $10,000 to small businesses across the state, and then a small business loan program, which provided loans of up to $50,000. These loans were later forgiven and converted to grants this year. Next slide. So I'll begin with our grant program, which began with $50 million in funding and was replenished twice in 2020 for a total of $145 million. These grants were for up to $10,000 or 3 months operating expenses, whichever was lower. Eligible businesses needed 50 or fewer employees, at least 1 W-2 employee that was not the owner, a valid Maryland unemployment insurance number, and they need to be in good standing with the Maryland State Department of Assessment and Taxation. Our application period was open from March 23rd to April 6th, and we received 17,876 completed applications during that time. Next slide. So we issued 14,286 grants to approved businesses over the course of this program. Of these grants, 9,274 were provided demographic data on company owners in either the initial grant application or in a follow-up survey of the businesses in the winter of 2020-2021. 4,341 grant awardees reported their business was women-owned. As you can see, that is substantially higher than the percentage of all Maryland businesses owned by women. So next slide. Our loan program received $75 million in March 2020 and offered loans of up to $50,000. The criteria was the same as for our grant program. We received 8,603 applications between March 23rd and April 6, 2020. The funds were exhausted by applications received on March 23rd and 24th. 1,654 loans were issued, and then, as mentioned earlier, they were converted to grants as ordered by Governor Hogan. The businesses that had already begun repaying the loans received refunds for those repayments. Next slide. So 1,654 loans were issued. Of these recipients, 1,136 provided demographic data. 485 loan awardees reported their business was women-owned, which is again higher than the percentage of all Maryland businesses owned by women. So next on to the Relief Act of 2021. Next slide. The Relief Act program I'll mention is our small business COVID-19 relief grant program. The legislation provided $10 million for grants of up to $9,000 for businesses that do not collect sales and use tax. This was a complement to the sales and use tax credits that were also established in legislation. So this grant was for businesses such as hair salons, medical offices, and personal and professional services. Restaurants and retail stores were not eligible for this grant. Eligible businesses need to be between 1 and 20 employees, at least one W-2 employee, which could be the owner, a valid Maryland unemployment insurance number, and they had to be in good standing with SSTAT. The Relief Act also required the disadvantaged businesses be prioritized and called for a geographic diversity among grantees. So we considered those criteria in our review process. Next slide, please. In the weeks leading up to the launch of this program, Commerce reached out to numerous community organizations, business groups, advocacy groups, and local chambers of commerce throughout the state. We accepted applications from March 30 until April 6, and then we reopened the applications from April 30th to May 24th. We received more than 1,800 applications. However, many did not meet the previous mentioned qualifications. Next slide. 1,131 grants were awarded through the Relief Act. Of these, 984 provided some demographic information. 475 companies reported being owned by women. Once again, well more than the proportion of all Maryland businesses owned by women. Next slide. So I do want to note that the additional support was provided both in 2020 and through the Relief Act for our restaurants and hotels specifically. These were also additional support provided through the Relief Act to businesses setting up online sales or telework opportunities. These funds were provided in a lump sum to each county to distribute to the businesses in their jurisdiction. Since Commerce was not taking the applications or issuing the grants themselves, we don't have comparable data on the percentage of women-owned businesses that receive these funds. We're still in the process of collecting and verifying this data from the counties, and we'll release that information once it's finalized. So thank you for your time, and happy to take questions after everybody else presents.
Great, thank you so much. We will hear next from, I'm sorry if I mispronounced this, but I'm trying my best.
I've been called a lot worse.
I'm gonna go with this as silent R. Zepikowski, Jim Zepikowski?
Repkowski.
Repkowski, silent Z. Jim Repkowski is the Assistant Secretary for the Division of Workforce Development and Adult Learning with the Maryland Department of Labor. Thank you for joining us today.
Thank you very much. And you took my first bullet. Yes, good afternoon, Madam Chairs, distinguished delegates and senators. I am Jim Repkowski, Assistant Secretary of Labor with the Division of Workforce Development and Adult Learning. Thank you for including the Maryland Department of Labor in this discussion as we discuss the impact of the pandemic on Maryland families. As requested, I'm going to try to focus my attention on women and youth, as both populations were impacted by the pandemic. And I will say already, having participated in the subcommittee or in this joint committee meeting, I have learned a lot about some of the data that we're seeing on the workforce side and what some of those reasons are for what we're seeing. So many workers in lower wage and hourly positions were the first to lose their jobs when the state and local governments restricted business activities based on CDC guidelines, which early in the pandemic, as we know, changed almost on a weekly basis. And of course, as we know, even today is changing and still evolving. Whether or not employed, families were faced with unexpected challenges, including in what resulted from school systems switching from in-person learning to virtual learning, resulting in young children remaining at home as opposed to attending school in person. Parents and caregivers of school-aged children adapted to their role as both a full-time teleworker or a job seeker in some cases, and added duties such as a part-time teacher's assistant, technical support, lunchroom attendant, and other duties to support their children's remote learning. As far as youth employment is concerned, the COVID landscape presented a major obstacle for young people hoping to prepare for careers and gain, I'm not even to those slides yet. This is just my introductory slide. So just go back to that one. Yes. Many of the jobs that youth gravitate toward were not available because businesses were either closed or their own workforce was teleworking. And it's very difficult to provide appropriate supervision to young workers when your workers are not even in the facility themselves. Despite the circumstances of the last 18 months, we do have some positive news to share. The Maryland workforce system and its partners are prepared to re-engage in the Maryland's economic recovery. And as Senator Carrozza mentioned in her question, there are no shortage of jobs or career paths. And quite honestly, there's no shortage of funding right now. It's a matter of taking the Kaiser Foundation survey of why folks aren't returning to work and figuring out how to get them back to work. But first, let's check the data that we do have to understand the impact. So we did look at labor force participation. So that's the next slide. And labor force participation is a measure of how many adults, it doesn't differentiate between male and female, that are either working or actively looking for work. Bear in mind that not every working age adult is included in a labor force participation rate because they may be in school, they may be retired, they may be choosing to stay home and care for a child, spouse, or parent. They may simply have resources where they don't need to work, or in an unfortunate case, and the one that we're concerned about, if they've just given up and stopped looking. Spanning January 2020 through June of 2021, the labor force participation in Maryland for women reached its highest point right before the start of pandemic in February of 2020 at 64.4%. Then, in just a period of 6 months, it fell to 59.4%. Comparatively, let's go to the next slide. The drop in labor force participation among men during the first few months of the pandemic only fell by about 40,000, whereas that number for women was over double that in the same period. Taking a longer view, between January 2020 and June of 2021, labor force participation among Maryland women fell by about 57,000, compared to ultimately a net gain for men of 13,000. The simple takeaway from that is more men returned to work and began seeking work by June of 2021, while many women had not. And again, refer back to that Kaiser Foundation presentation, Family Foundation presentation, as to the reasons why why women in particular had not returned in the same numbers that men had. Slide number 4, in the first 2 months of 2020, before the pandemic hit, the average share of women who received unemployment insurance benefits was 35% versus 52% for men. From March of 2020 to June of 2021, the beginning of the pandemic, and through the most recent data that's available, the share of women who received unemployment insurance rose an average of 49%, while men's numbers fell to 39%. Note that these numbers don't add up to 100 because we have a category where we don't necessarily identify by gender. But what this says to us is that compared to pre-pandemic, more women applied for unemployment insurance benefits compared to pre-pandemic levels. And you can attribute that there were new federal programs for independent contractors, self-employed, closures in the hospitality industry, and other industries that have a higher concentration of women participating in those industries. But it is very hard to compare pre-pandemic to now, just because there were so many variables. As far as the youth employment, according to a Mathematica's youth employment tracker, Maryland's youth unemployment began in 2020 with an unemployment rate for youth ages 16 to 24 of 7.8%. In just a matter of months, that jumped up to 27.4%. Again, Maryland's youth lacked the opportunity during the pandemic to seek both wages and work experience. Moving past those statistics, I do want to share that we do have some good news, and we do target program and services to both women and youth. A little known fact is the U.S. Department of Labor has a Women's Bureau, and that Women's Bureau actually turned 100 years old in June of 2020. And we have actually sought some targeted grant opportunities from the Women's Bureau, again, to target women populations. On our Title I adult programs, again, the adult program doesn't distinguish between men and women. It is for adults. But we do have opportunities to pursue grants to target the women population. And I just want to highlight two of those. One being our hospitality pre-apprenticeship program, launched in 2019, and that was pre-pandemic. But we are working in Maryland's prisons to get individuals who are incarcerated, particularly at the women's prison, expanding programs there. We're expanded to a barbering program. We have a hospitality program so that women who have faced incarceration have industry recognized credentials and skills upon release. And of course, we also in the department have reentry navigators where we connect those individuals, we connect with them behind the fence. And then when they come out, they have an individual to meet with at an American Job Center to help navigate them through. We also funded 2 other programs, Maryland New Directions and Pivot. Again, these were programs funded by a grant that we got specifically from the U.S. Department of Labor's Women's Bureau. I want to switch to the Apprenticeship Maryland slide. Apprenticeship Maryland was actually passed as a pilot program by the Maryland General Assembly in 2015. It was 2 counties. Maryland Department of Labor made it permanent in 2018. And currently 20 of the state's 24 school systems are participating with the Apprenticeship Maryland program. Students in the AMP program can pursue education based in career pathways in industries such as manufacturing, science, technology, engineering, mathematics, as well as many other occupations. Students apply for the program in their junior and senior year, and there is a component of 450 hours of paid work-based training under the supervision of an eligible employer. They receive, students who receive credit towards the high school diploma also complete a post-secondary credential program, which that credential they can use to seek gainful employment after they complete the program with the employer that they were assigned to. We started out with just a few employers, but with the growth of the program, we have 200 employers that have been approved for the program, and we have over 100 students that are currently signed up to be youth apprentices in the statewide school system. I would just note that in 2016, we started at 11, and I see Senator Eckert is on the screen. We attended a signing ceremony in Dorchester County just 2 months ago, where the employers did a nice signing ceremony, kind of just like you do for college athletics. We were doing this for trades programs and employers in Dorchester County, and we encourage that. In fact, when an individual graduates from the Apprenticeship Maryland program, the department has purchased those cords that individuals wear at graduation, because we want to equate pursuing workforce and career pathways with all of the other academic things that individuals get awarded cords for, again, to promote, so that when folks are walking across the stage, you know, mom and dad or aunt and uncle, why does that person have a cord? Well, they have a cord because they're pursuing a career pathway. And ultimately, that pathway is going to lead to what we consider the gold standard, which is a registered apprenticeship program, which is a full-time job with benefits, on-the-job training, related instruction, and of course, you know, well, pay. That's the whole part of it. Labor oversees the state's implementation of the Workforce Innovation and Opportunity Act, WIOA, or WIOA, Title I youth programs, is funded by formula by USDOL. So every year, there's 13 local workforce areas. A local workforce area is either an individual county or a collection of counties. We have 13 local areas in Maryland, receive targeted funding that goes directly to those workforce areas for youth programming for individuals aged 16 to 24. They must spend a minimum of 75% per federal law, not state law, of those youth funds on out-of-school youth, and particularly those who face barriers to education and employment. In addition, federal guidance says that they must spend 20% of the area's local Title I youth funding on work experience. All 13 local workforce areas do offer summer employment programs and work readiness preparation programs in their local areas. However, during the pandemic, we did see a number of local areas have to return funding that they were allotted because they just did not have enough businesses participating and they did not have enough students to place. So a message there is, again, funding is not an issue. It is a matter of businesses opening and individuals returning to work. Lastly, I would just highlight that thank you to the Maryland General Assembly in your fiscal 22 budget that you passed, there was ARPA money that was designated to workforce development, over $75 million over the next 2 years. Our department has actually already deployed a majority of that money to the 13 local workforce areas. The state did not get to keep any of it. We deployed it to those local workforce areas, which is really literally doubling the amount of workforce training dollars that they have over the next 2 years. So they will get their federal allotment, and then they will get an equal amount of this state allotment, which are US Treasury funds. They're not US Department of Labor funding. So what that means is that money is very, very flexible because it doesn't have the strings that are attached that usually occur with US Department of Labor money. So we are really looking to our local areas, and of course, they can target this newly found training dollars on any of the target populations that they see in their local areas. And just in last statement on the closing, which I don't have a slide on, is I know Commerce mentioned their programs. I did not include information, but Maryland Department of Labor administered the layoff aversion program. It was $30.1 million. I don't have any specific statistics now, but we did deploy over $30 million to businesses that purchased technology or did other things to avoid laying off individuals. And those were grants up to $50,000, and we funded over 1,200 small businesses. I don't have a breakdown of how many women businesses at this point in time, but we too had a grant program that encouraged businesses to buy the PPE they needed, get the technology they needed to keep their businesses open so that they could operate and keep their people employed. And that's why we called it the layoff aversion program. I know where there was a question earlier about from, I think it was Senator Benson, and there was another question about wages and so forth. I do not have that information that was asked about prevailing wage, or next it was Delegate Krebs. That would be something that we can get if Delegate Krebs wants to re-ask the question. Our legislative person is on, and we can take that question and ask the Commissioner of Labor and Industry, who oversees the sick leave program. So with that, I will just end and say thank you, and I'm happy to accept any questions at the end.
Wonderful. Thank you so much. And we do have a number of panelists from the Commission for Women here, so I want to hear from them, but let me, just for streamlining purposes, repeat the questions that you were talking about. There was the one from Delegate Krebs. So we wanted to know what impact has the paid sick days bill had, particularly, have people been utilizing that? Are people in need of more leave beyond that? Because it's only a couple of days and this has been going on for 18 months now. I think that Delegate Senator Carrozza's question was, what are we doing to get women who are out of the workforce into those in-demand jobs? So if we could get any specific information on that, that would be really helpful. And I believe Senator Benson had a specific question earlier about, are we tracking women specifically? It looks like we had one slide in here that showed that women had lost 57,000 jobs and men had gained 13,000 jobs, and that women are claiming more in UI than men. So we do have that data, but is there anything that's tracking, particularly with breakdowns of race also would be really helpful, women's specific experience in COVID, and are we tracking that now, and what are our plans moving forward? So any follow-ups on that would be great. We'll hold all the rest of the questions until we hear from the Commission for Women, because I think they can fill in some gaps, and then we'll take everybody's questions for all of the state agencies. From the Commission for Women here, we have 4 folks, so I'm not sure what order you want to go in. On my agenda, I have Yoon Jung Yang, who's the chair, and then Reverend Tamara Wilson, as well as Dr. Rita Kirschstein, and of course, Judith Vaughn Prather, who is the executive director. Who would like to go first?
I'll go first.
Great, thank you for being here and for the work that you do.
Well, thank you. Good afternoon, Senator Washington, Delegate Kelly, and members of the Joint Committee on Children, Youth, and Family. Thank you for inviting us. And my name is Yoon Jung Yang, and I am the chair of the Maryland Commission for Women. As you mentioned, joining me today is Reverend Tamara Wilson, who is the chair of the Status of Women in Maryland Committee. Dr. Rita Kirschstein is our research consultant for the 3 phases of this project, and our executive director, Judith Meredith Von Prather is here with us. The Maryland Commission for Women is a 25-member advisory board whose commissioners are appointed by the governor with the advice and consent of the Senate. The commission was first established in 1965 as the Governor's Commission on the Status of Women. In 1971, we should be on slide 3 right now. Thank you. In 1971, the commission was reestablished as the Maryland Commission for Women, and it was permanently set into law. So we consider this year, 2021, our 50th anniversary, and we're so proud to have published the Maryland Women Status Report, during our semi-centennial year. Slide 4, please. In 2016, the Maryland Commission for Women launched the first phase of our 3-part Status of Women initiative with the Voices of Maryland Women listening tour. We traveled 3,000 miles across our beautiful state over a 2-year period and conducted 19 public forums. In addition, a survey was available in 4 languages to gather further information on women who may not have been able to attend any of the in-person forums. In their own words, the Voices of Maryland Women, published in August of 2018, identify the top 5 issues presented by more than 1,400 Maryland women who participated in the listening tour and survey. The top 5 issues they shared with us were domestic violence and sexual assault, paid time off for parental and medical leave, drug abuse and addiction, too few women in leadership positions, and affordable and quality childcare. Next slide, please. To illuminate the areas of concern, the commission undertook phase 2 of the Status of Women initiative, extracting and compiling the most current available information about Maryland women from statistics published from a range of federal and state agencies, as well as private research and policy firms. To do that, we contracted with Dr. Kernstein again. The data she collected is presented in the Maryland Women Status Report released on June 10th, 2021. Today, I will share with you some of the more pertinent findings with you and tell you about the current phase of our research. Next slide, which should be slide 6. Thank you. As you know, the state's population of more than 6 million is a little more it's about half of is female. But as the population ages, the percentage of women increases. So the overall women to make up 51% of Maryland residents. But there are more than 65 of those are 85 or older. 1/5 of adult women in Maryland are either divorced or widowed, and 34% have never married. Next slide. Highlights, which should be slide 7, thank you. Highlights from the report know that there are several glass ceilings that women have shattered in our state. The highest ranking judge in Maryland is a woman, the first ever to hold that position. The state superintendent of school was a woman at the time the study was conducted. For the first time in Maryland's history, the Speaker of the House is a woman. Yet many disparities remain, including a gender-based wage gap persists, which is especially significant for women of color. In general, men average 13,000 more per year than women. With college degree, men average 30,500 more than equally educated women. What that means is that the average white woman will have to work to the age of 71 to earn what the average white man earns by age 60. The average Black woman would have to work to age 79 to earn what the average white man earns by age 60. Now, the average Hispanic woman will have to work to age 108 to catch up to the average white man has earned by age 60. This is particularly true because 60% of all minimum wage workers in Maryland are female, and because women still tend to be clustered in a few occupational categories. In fact, almost 1/3 of all employed women in Maryland work in either healthcare or in education, Slide 9, please. Childcare represents a huge and for many unsustainable percentage of a woman's income. The average cost of an in-home childcare is more than $29,000 per year in Maryland, more than $10,300 for care at a center. For a woman working as a cashier or as a cashier at a grocery store, or even administrative aide or registered nurse, these rates are simply beyond reach. Even in the field of education, where so many women spend their careers, we found disparities. More than half of all community college presidents are women, but only 27% of presidents of four-year colleges and universities in Maryland are women. In both public and private colleges and universities, as the faculty rank increases, the percentage of women decreases. Slide 11, please. When exploring the most significant health issues for women in our state, we found a significant disparity in infant mortality in the state based on race and ethnicity. For both white and Hispanic newborns, the rate of infant mortality is less than 4 per 1,000 per birth. But the infant mortality for African American newborn is more than 10 per 1,000 births. That's 2.5 times higher than other babies born in Maryland. Slide 12. Of course, women in leadership positions have the opportunity to address these issues directly. Yet, as you know, only 3, making up 13% of Maryland's 24 major jurisdictions, are headed by women. Only 76, making up 41% of the 188 seats in Maryland General Assembly, are filled by women. And there are no women among the 10 legislators representing Maryland at the US Congress and state. Slide 13. One more general finding about our research was that for most issues studied, we could find numbers by gender or numbers by race and ethnicity, but often we could not find numbers by both gender and race and ethnicity. To truly understand the experience of women or men in our state, we need to be able to examine the intersection of race and gender. As you have seen from the data we have presented, the experience of one racial group of women may be different from that of others, but all are affected by the fact of being a woman. We encourage all organizations and agencies to collect and analyze information by both gender and race and ethnicity to fully understand the needs of our constituents. There's a great deal of more data in our report, but we don't have the time to present it all today. The Maryland Women, a Status Report, is available in full on the Maryland Commission for Women's website at www.marylandwomen.org. We would also be happy to send you hard copies if that would be helpful, so please let us know. Now, Reverend Tamara Wilson chairs the Status of Women in Maryland this year, and now will share with you about our current research on the impact of COVID-19 on Maryland women. Reverend Wilson?
Thank you. Good afternoon, Senator Washington and Delegate Kelly and all the members of the Joint Committee. Thank you again for inviting the Commission to share our research today. Even as this research for Maryland Women, a status report, was being conducted beginning in March 2020 and continuing well into 2021, the state, the nation, and the world experienced the unprecedented challenges of the COVID-19 pandemic. As the virus swept through communities, change was sudden and drastic. Schools, businesses, and organizations were forced to close their doors to avoid spreading the virus through in-person contact, and many people lost their jobs. Others were forced to work from home, while students across all levels of education learned through virtual platforms. Next slide, please. Much has been written nationally about the pandemic's unbalanced impact on women, especially working women with dependent children. As Delegate Kelly said at the outset of the meeting, the Brookings Institute has stated that COVID-19 is hard on women because the U.S. economy is hard on women. And just as the report, the Kaiser Family Foundation stated, millions of women were already supporting themselves and their families on meager wages before coronavirus and the lockdowns, then sent unemployment rates skyrocketing and millions of jobs disappeared. With the evidence showing that working women or working mothers have taken on more of the resulting childcare responsibility and are more frequently reducing their hours or leaving their jobs entirely in response to the COVID. Next slide, please. It was these kinds of findings that led the Maryland Commission for Women to launch phase 3 of the SWIM research project in June of 2021. This third and final phase of the research will examine how Maryland women specifically have been affected by the pandemic over the past 17 months, and to seek to understand the challenges women continue to face as society begins to recover. We'll also look at the impact of the pandemic on women and their families, how their families experience the pandemic, and what is needed for them to begin this new normal that we're all looking towards. Next slide, please. The research is being carried out in 2 steps. The first is an online survey that is available in 5 languages: English, Spanish, Chinese, Korean, and French. We've partnered with the 14 county commissions for women around the state who have encouraged the women in their communities to participate in the survey. Counties from which at least 200 responses are received we will provide with specific data for that particular county. Next slide. The survey was launched on August 4th and will close on September 30th. So we're coming up on that fairly quickly. So far, more than 2,500 women have completed the survey, with every one of the 24 major jurisdictions in Maryland participating. We also solicit your support in ensuring that women in your districts participate in the survey. The second step in the project will be a series of 6 focus groups, which will be conducted virtually later this fall. 3 of these groups will be general in their focus. The remaining 3 will concentrate on specific areas of impact, such as mothers with young children, women, business owners, and essential workers. Our goal is to complete the research this fall and publish the results in early January 2022, which we hope will assist you in shaping policies that impact women this legislative session. So I'll turn it back over to you.
Thank you so much, Reverend Wilson. Let me tell you, she's doing an extraordinary job coordinating the work of our committee and our research consultant, Dr. Kernstein. We would be happy to come back to you as soon as our report on the impact of pandemic on the women of Maryland is published. We very much hope that the report will help both the executive and legislative branches of Maryland ensure that the recovery policies and programs they develop address the very real needs of Maryland women and their families. Thank you again for inviting the Maryland Commission for Women to discuss this research with you. We will be happy to answer any questions at the end.
Wonderful. Thank you so much. Did either Dr. Kirstein or Judith Von Prather have anything to add? Are we good to open for questions?
We're here to just answer questions if they need help.
Wonderful. Thank you so much. So now from the committee, I know that Delegate Ebersol has been waiting patiently for his question. Go ahead, Delegate Ebersol.
This just came up early, so I did want to forget I had. Thank you, Madam Chair. This goes back to Sarah Shepard's presentation. Slide 5 has some information about how money was provided loans to small businesses. And I was looking at some of the numbers and wanted to get to shed some light. There were over 8,600 applications, but only 1,600 were awarded. I did do a little math and figure out that if you divide 75 million by 1,600 or so, you get about $45,000, which is in the range of the amount that you were giving. So it looks like you ran out of money. I'm guessing. You can confirm or deny that to me that was enough. If that's true, though, I'm wondering how the 1,600 were selected, what the selection process was, in particular to this committee's meeting today. Did we pay attention to women-owned businesses when we prioritized them?
Yes. So for slide 5 particularly, that's for our loan program, and we did run out of money. So that was a $50,000 additional loan. So when we were refunding the programs, because we had ran out of money for our grant program as well, and what we found was most people who applied for the grants also applied for the loans at the same time. So we funded every fundable application for the grants. So if you were eligible, you received funding for the grants. We did that because we did multiple rounds of funding for that. And as soon as we ran out of money, like as soon as we funded everybody, that was done. The loans was different because it's a higher amount. So when we were trying to think of how we could truly impact businesses and, you know, help support the most amount of businesses, it was the grants. That was the way to go because we just didn't have enough money to fund that amount. Now for the 8,600, not all of those applications were fundable. They did not all qualify. We also had quite a few duplicate applications because people would resubmit multiple applications. And so we had a very thorough process. So that sometimes increased our number of how many we received based on how many were actually eligible, fundable, and non-duplicates. And then what was the second part of your question?
Yeah, so given that that's 20%, about 1,600 out of 8,600, is a little less than 20% of the people of the businesses that applied got it. You've named a number of ways that you called that down, but once you got down to it, I'm sure there were some that you had to make decisions, and I was curious what your criteria was. And like I said, particular to today's meeting, did we look at women businesses as a priority factor there?
So for this round of funding, because it was emergency funding and it was, you know, we started this program, we were building the plane as we were flying essentially. So it was first come, first serve. So that was just because we didn't know what the impact of COVID was going to be at that time. It was announced when essentially everybody was shut down that we had these programs. So as long as you qualify and you met our qualifications for having under 50 employees, you had a valid unemployment insurance number with the state, you had at least one W-2 employee, and so forth. That's as long as you checked all those boxes of our qualifications, you received the funding.
So it was first in, first out in this case.
It was first in, first out. Also,
any statistics on how they came down in terms of women and minority-owned businesses in that case? Do you have any idea? I know you might not have it at your fingertips, but I'm curious.
I don't have my fingertips. We do have some of that data from our research team, how it broke down. The only difference is for one, we have the questions whether or not you're minority owned, women owned. It's all self-reporting though. So we can't legally qualify them based on that status.
Okay. Yeah, okay. Maybe I can hook up with you. I'm just curious. I'm going to look at a couple others too and see how they fell out in terms of those businesses receiving them if we can.
Sure. And, you know, I'm happy to send you information later on from our research team about how the breakdown was, but it was self-reporting and whether or not they actually said what what box they checked on there, as well as for our follow-up. Our follow-up survey that we did after the loans.
Because we do have data on that, right? SWMOBA gives us data on what businesses fall into those categories.
SWMOBA is a little different though, because it's a program that's designed specifically for small minority women-owned businesses. Mm-hmm. This is through MEDAF, so it's a little what we can actually pull, and this wasn't a program designed specifically for small minority women-owned businesses.
Right. I just wondered if the data was there. I'll check.
Yes, we have the data. It's just a matter of, I don't know if it's we can't say it's completely accurate because it's all about self-reporting. So if a business decided not to report whether they were a minority or women-owned business,
they have to enter the program.
We don't have that.
SWMOBA, right?
Yes,
I've taken up more than my share of the time. I know.
Okay.
Sarah, I can check in with you on that.
Sure. Yep.
And it sounds like I'm reading in the chat, Senator Sidner is also interested in this information. So if you could share that with the committee when you figure out what you have that you can share, we'll make sure to circulate that as well. Delegates,
should I just send it to the staff and then they can circulate it to the committee?
That would be great, yes.
Okay.
Delegate Smith has a question.
Thank you, Madam Chair. This is a question for Sarah related to data moving forward. I do understand that depending on the nature of the program that's providing, support to businesses, that capturing certain data might not happen with the same completeness, right? So I understand that for things that are not based on upholding and supporting minority and women-owned businesses, that you cannot use the provision of that information as the basis for decision-making. But couldn't there still be a notion that your application is either complete or not, which does not mean you're using that information to make the decision, but it's a part of having a complete set of data to reflect upon moving forward? Because I'm concerned that if people choose to share certain information, it creates almost this we're willfully ignorant. Like, we do not have all the information to know if we're advertising, marketing, or otherwise getting the word out adequately to all impacted businesses or businesses that could benefit from certain programs. I know that there was a report that Prince George's County and Baltimore City businesses were underperforming and receiving help from your agency as it relates to COVID relief and small business. So that's like a perfect example of, I don't think it's about like intent, but if you don't know how you're doing along the way, you might not have the ability to like course correct, ensure you're getting the proper word out and things like that if you can't track who's at least applying. Not saying you're using that for the basis of decision making. So is there any conversation about that moving forward?
Okay, so you hit on two separate things I'm going to address. So first, with Baltimore City and Prince George's County, with the report that I believe you're referring to, or the information you've been referring to, that is not completely accurate. We actually had our research team delve down, and the numbers aren't as big of a discrepancy as it was alluded to be. So I, again, can send that to the committee staff about how that kind of broke down, as well as for it being required for a complete application. And I don't have our assistant AG here to, give me all the legal things, but from my understanding from these conversations, we legally cannot require that as part of the application. So it's same with when you are applying for a job, for instance. It is legally, you can legally not require an applicant to say what their race or gender is. The same goes for this. So we have the option of other or choose not to report. So they can click that and we still won't know what the reporting is. So even if that's the part, we're still not going to, if they click chose not to report, we're still not going to get the full picture.
Okay, I appreciate that answer, and I look forward to seeing how not big a deal the discrepancy was that you've noted. Thank you.
Thank you. I have a question. I don't see any more questions from the committee members, but raise your hand if you have a follow-up. I have one for Jim. Thank you for answering Senator Sidner's question in the chat. In terms of the Department of Labor, I heard the Commission for Women really making the recommendation that all agencies should track both race and ethnicity as well as gender and the intersection on that data. So I want to refer back to your slide that talks about the job losses for women as compared to men. Do we have that data with the intersection of race? Do we know, are disproportionately women of color impacted in those job losses?
So we capture a lot of data, and it is all driven by our funder, which is the U.S. Department of Labor. There are actually literally thousands of fields whenever we're spending this federal dollar. So if there are specific data points that you are looking for, I can certainly see if we track them. Off the top of my head, I don't have a specific answer for you, but I'm always impressed by our Office of Workforce Information and Performance when we ask them a question, do we have this? And they say yes. And then I said, well, then can you narrow it down one more? And then all of a sudden we're down to how many fingers and toes that they have and what color the paint is on them. So we do capture a lot of data. I can't answer specifically now, but if you pose a specific question as to what we're capturing, our data team is quite amazing.
Great. So I think it would be really helpful if we could get sent to the committee. If we have it, I would hope we do. I would expect it's in the federal guidelines, that breakdown of job losses and also unemployment with the intersection of both gender and race and ethnicity. So we can determine that. And then my follow-up question is that on the first multiple presentations we heard about specific sectors, particularly healthcare aides and home healthcare workers, nursing care workers, as well as childcare workers. Those are the subjects of our next 2 meetings. And I don't know if you have specific data in terms of job losses, folks who left the workforce in those sectors that are predominantly female and also high risk in terms of COVID and low wage. I think we would really benefit from looking at that specifically. And then the bigger picture question is, and so I would really appreciate it if we have that, if we could have those for the next 2 meetings, one in October and one in November. So as we're developing a plan for those workforces, we can think about how we can partner.
Certainly, if the committee staff sends those to Andrew Fulgenetti, our legislative person, and try to be as specific as possible for the data, whatever we have, we're happy to share with regards to both with the numbers that you requested.
Awesome. And then just the final question is the big picture question, right? It seems from what we've been hearing all day that there's a huge gender gap here in what we're dealing with in terms of getting the workforce back to where we want it to be post-pandemic or mid-pandemic, wherever we may be right now. So, what is the administration, and I guess Commerce could answer this as well, but what is the administration doing specifically to address the gender gap, if they're doing anything now? And if not, is there a plan to, and this sort of folds in the Commission for Women, can we work with, they're doing tremendous research. It sounds like there's a report is going to be available in January, and we're going to know a lot more Maryland specific information about what women in the workforce need. Can we get a commitment that you all are going to be working with them, looking at that information and developing a specific plan related to this gender gap and the specific needs of women in the workforce?
Certainly. I mean, we work very closely with the Commission on Women. I believe we have an appointee or designee that supports them. But certainly this is important information to gather and be on top of it. And, on the workforce side itself, we work in targeted populations. All of our funding and all the things that we're measured on is for a target population. We put everyone in a category. We do track the information, and we're certainly willing to collaborate. That has been a hallmark of the Hogan administration, that interagency, interdisciplinary working together. It's easy to get stuck in your individual agency silo, but these are good reminders that when we're having these impacts to specific target populations, cross-agency collaboration has us do better work and get better results.
Thank you. And the final question I see is from Delegate Solomon. Oh, I see. Let's hear from Judy Von Prather. It looks like she has an answer as well. Judy, before we go to Delegate Solomon, what do you have? Maybe
I actually have a question, a quick one.
Okay.
As you know, we're in the middle of this survey now. We have about 3 weeks left. A number of you represent communities where we are really hoping to get more responses to the survey from. We need to have answers from all over the state, and we need to reach the mid-shore. We need to hear from Prince George's County. We need to hear from every jurisdiction, the southern part of the eastern shore as well. And if we could send your staff the links to the survey, would they send it out to all of you? And then if we could ask you to share it with your constituents and help us reach the people in your communities to be sure the women from the women you represent get their voices into this survey, that would be so helpful.
Absolutely. Send the links to the staff, and we'll make sure it's distributed to the whole committee. Thank you. Delegate Solomon.
Thank you, Delegate Kelly. I just had a quick comment, and question, I guess, for Sarah. Sarah, thanks for being here, and really appreciated Commerce's help really during the last year in the pandemic and trying to think creatively about how to help childcare businesses. Frankly, you all were way more helpful than MSDE was. I guess one of my requests with new leadership at MSDE, with the new superintendent, I think one of my biggest concerns was MSDE doesn't really think of childcare, or we often don't think of childcare as actual businesses themselves. And so the work that Commerce does to help small businesses is very siloed because childcare is considered part of MSDE. And therefore, it's more sort of on the education side, as opposed to the fact that these are small businesses run often by people who are juggling multiple different jobs and often have to be the bookkeeper and do all the business side of it while also having to literally run the childcare component as well. So I guess maybe it's an ask for you, you know, and the secretary to reach out to the new superintendent and really think about creating more of a partnership. I know I had requested some data in the budget last year, you know, around the MEDAF program and looking at the infrastructure support dollars that go through MEDAF to actually see what childcare businesses have been able to take advantage of it. But hopefully we'll get that, I think, in the next couple of weeks. But I think longer term, you know, if Commerce could think about more partnerships with MSCE around creating and bolstering the business component of childcare would be really, I think, really beneficial to the community as a whole.
Yes, and I have not been as involved with the childcare side of things, but that is something that we have been working on, and we do have a report coming up, as you've mentioned. So we are working on that. I will also say I don't have the data in front of me right now, but having been involved with this, especially for our previous grants and loans programs, we did actually fund quite a few childcares, especially a lot of them fall into the nonprofit realm. A lot of times they're involved with the church or something. So based on if they met our qualifications, we did fund quite a few of those as well.
That's great. Yeah, I mean, I think your agency was really helpful. Frankly, the roadblock we ran into was often MSCE, I think, territorially said, childcare is our domain, you know, leave us be. But I think, again, I'm hopeful with the new superintendent and the added emphasis on the importance of childcare for economic development in the state, that we can start breaking down those walls and really think collaboratively between the two agencies.
Yeah.
Thanks.
Great. Thank you, guys. I'm sorry we went 5 minutes over, but thanks to everyone who presented. We really appreciate it. I will just remind the committee that our next meeting is going to be on long-term care, and we'll be talking both about workforce issues in that home health care space and in long-term care, again, largely impacting women. And of course, our 11, that's going to be on October 6th. At 1 p.m. And then at November 10th, we have the childcare and education meeting. So again, we'll see similar topics related to childcare. So hopefully things will all sort of come together, and then we will meet in December 8th to come up with some recommendations. So look forward to seeing the rest of the committee again on October 6th. And thank you, everyone. Have a great afternoon.